Suman Rastogi is a professor in Tirthankar Medical College, Moradabad, married profile surgeon. Evolution of pterygium surgery, suture to no suture.
First of all, I would like to thank AIOCMT3 for having me here. So I'll be discussing about the evolution of pterygium surgery. That we have seen that how does this pterygium surgery has evolved. We have seen cataract, it has evolved from needle and couching to femto right now. But how does pterygium has evolved, and what are the recent concepts and what are the future concepts? So you've seen that my talk will be covering how the pterygium surgery has evolved, what is the current scenario, and what are the future concepts. So I am not going to the definition of pterygium, we all know it. It's a very common pathology, but the management is very less discussed, and it is frequently called as a surgery of residence. So we have seen the cataract surgery has evolved from ICC to femtosecond laser, but pterygium surgery has evolved from needle and thread eversion to pterygium excision with glueless, sutureless autograft. Coming to the historical background of the management, we had needle and thread eval technique, head transposition technique, then we have bare sclera technique, bare sclera with radiation and strontium 90, use of mitomycin C. But in all these techniques, something which was very common was the recurrence was very common. So, and in cases with mitomycin C and radiation, we have complications like scleral and corneal perforation, ulceration, secondary glaucomas, cataract and iridocyclitis. So in later half of 20th century, there was a concept of graft was introduced, and we had pterygium excision with amniotic membrane grafting, then rotational autografting, conjunctival transplantation, autograft with sutures, autograft with glue, double-head pterygium was with graft splitting, mucous membrane graft, etc. So coming to one by one to few important surgeries, like we had a rotational autograft in which the pterygium was resected and it was rotated to 180 degree and it was implanted, but there was recurrence, too much of recurrence at that time. Then pterygium surgery with amniotic membrane graft, we did as a residents, we started with this surgery for the pterygium. Then conjunctival autograft with sutures, we have been doing it nowadays also with this procedure in like whenever we have the excess of glue is not there. Then till now in all the procedures, sutures were required, most important thing. And it was cumbersome for the patient and surgeon both. Due to suture related problems like irritation, watering, pain and rarely sutural granuloma, patient's quality of life was compromised until sutures were removed. So the concept of conjunctival autograft with glue was introduced. But again, the high cost of availability, high cost and availability of the glue was the problem. And I remember that we used to collect the patients for a glue and then take the glue, and then we used to operate the patients, like 4 or 5 patients in a session. So this was the problem with the glue. So so we require a new modality that can reduce the recurrence, they can reduce the availability of antimitotic drugs, irritation with sutures, suture granuloma, and cost involved with the glue. So the concept of pterygium excision is sutureless, glueless conjunctival autograft was introduced, in which we use autologous in situ blood coagulum as an adhesive for the graft. And advantage is that no suture-related complications and granuloma, less time consuming, cost effective, and less recurrences. So this is a short video in which I've taken this video after the removal of the pterygium. So you can see the graft is being placed over the limbal area, and it is being flattened. It's a quite easy procedure, nothing to be done much. Only thing is that you have to give some time to this surgery, little bit. And it has been placed over the limbal area, flattened, and just give some time, at least 2-3 minutes to get it settled, and then you can close the surgery. Nothing else is required. So there were different studies in past 4 or 5 years which says that sutureless, glueless limbal conjunctival autograft is a quite reliable method for surgery for the treatment of pterygium. And we did a retrospective analysis. Actually, it's not a study, but just analysis for past 6 years. We did about 522 pterygium removal with glueless autologous suture graft, and patients were followed up to 1 year. And we had about only 3 cases of graft rejection, graft retraction in 5 cases, recurrences in 5 cases, and conjunctival cyst in 2 cases. So it's a quite reliable method as far as this analysis is concerned. It's not a study, it's an ongoing, like we are still doing it, but just for the results sake, I'm just presenting it here. So this is the day 1 picture, and this is after 1 month. So the conclusion was that autologous fibrin in blood is a useful alternative method for graft fixation in pterygium surgery, having excellent outcome, being less time consuming, avoid suture-related problems, and cost of fibrin glue. This is a neo concept which is still evolving, that use of conjunctival tissue graft from the pterygium itself without rotation. So this is not in books, not in, like, it is still evolving, in which the surgeons, what they're doing is they're just taking the pterygium and removing all the subconjunctival tissue and just placing it over the limbal area. So it is like long-term results are still awaited, but it is useful in post-apectomy cases, both nasal and temporal pterygium glaucoma cases with superior limbal conjunctiva where it is to be preserved. So this way, they just remove the superior upper part of the pterygium and place it over the limbal area, remove the subconjunctival tissue. So long-term results still awaited. I have not done myself any surgery. I have just found it in the research papers, but maybe this can be a future concept for the pterygium. Thank you.
Excellent presentation, Dr. Rastogi. I think this is the future, what you said. If you take the pterygium itself, clear the subconjunctival tissue and put it back there, that probably be the least hazardous to the conjunctiva. The whole anatomy is preserved. And that will have long-term benefits. Like you rightly said, the long-term results are yet awaited.